want to ask the Director of Finance or the Commission whether there is what is termed as HIV fund, as it was created under the HIV Prevention and Control Act, and if so, if it is active, and by that I mean whether, because it talks about some collections which has to be made from some items like cigarettes and beverages, because this could in one way or the other fill the gap which was created by the cut from US, and how are you planning, which is among the so many funds like the road fund and what have you, which have never been put into effect despite the existence of the act. Thank you.
Okay, yes, Mr. Quinto, can you respond?
Thank you once again, Honorable Chairman. And 600 billion, which that is the money which it has been cut, the one which was coming from the American, from the USAID. So that's the one which the government of Uganda now is making provision because in Uganda the government has been making provision of about 300 billion. So this is the 600 which has been cut. So topping up on what the government was already making, it will come to about 900 billion, which is the required money, almost 2 to 1 trillion. So that's the gap which has been there, and that's the one which is going to come to Parliament for the next financial year to add onto the budget of Ministry of Health to make provision for that. Activities and services. These are mainly the laboratory testing and then treatment areas that has been, those are the ones which have been maintained. Then in terms of the drug availability, one of the areas also which has been affected is delivery. Some of these medicines are already, they are there in the stores, but part of this money has been used for delivering them to the different regions. So that's why the gap has been. At the moment, if there is, you find maybe areas where there are no drugs, it is actually because of the issue of delivery. Because part of this money is, it has always been used, part of it for delivering medicine to the respective areas. Then, Chair, on the issue of the, I believe the Honorable is talking about the AIDS Trust Fund. Of course, this was an act. We actually had a regulation which formed this trust, and Parliament actually, I remember Parliament authorized about 10 billion to be put on this fund, but unfortunately, there was a conflict in the law. The Public Finance Act does not allow any money to go to any fund to be created apart from money going to the consolidated fund. And that's where the issue, up to now, that's why it cannot be implemented, because there is a conflict in the law. Chair, I think that's what I can say.
Okay. Mr. Chairman.
What we need, drugs are not there because of lack of transport. That is one.
Yeah.
I want to get that clarity from you. Because if people are dying and the drugs are
it is better to say the drugs are there, but there is a problem of delivery.
That's exactly what I want to get from you.
Yeah.
Because people are dying, and they are saying drugs are not reaching out to the people because of transport. Is that true?
That is initially what has been the problem. But that's the gap now which government is coming in to fill in. Because initially much of this transportation of the drugs you see, the money was coming from actually external funding.
Okay, then two, we also need clarity from you. we always see vans and always get messages from Uganda medical stores delivering medicines. Is that true to the districts? Is that arrangement different from the AIDS drugs? National medical stores. They always deliver medicines at the district and you're always getting messages. We have delivered. We have delivered. So I want to understand, is that arrangement different from drugs for the HIV?
The question is clear.
In the budget, because right now you already have some figures from Minister of Finance.
Yes.
Ugandans would want to understand, out of the 600 billion that was cut, which was funding from the American USAID, how much money is right now in the budget for the next financial year to cover the 600? Ugandans will want to understand. Because as I told you, Ugandans are dying. So they would want that assurance that next year we shall have medicine.
Ngoli, please.
Be right from the time the aid was cut, because that was, I think, around the 28th of February or earlier than that. My interest would be, what interventions have you done with the relevant ministries, like Minister of Finance engagement? What proof do we have on file? Because you know this committee is evidence-based, so that we can help you. What kind of support do you need from Parliament to ensure that we help you and you seal off the gap?
Okay.
And of course, those are interventions. Then two, my interest as a member of the committee would be lessons learned, because this was an emergency that came. What lessons have we learned from this, so that we prepare better? Because there is no guarantee that we shall get back that aid. But what lessons have we learned? Then how do we improve from the lessons learned? That is what I expect from the accounting officer.
Yes, Director of Finance.
We learned, and Chair, even before this cut came, Uganda AIDS Commission had already foreseen that with the time there is going to be a cut. So Uganda AIDS Commission started the process of roadmap for sustainability. We actually engaged so many stakeholders, and we, in fact, is part of the audit report you will find. We actually, the next step we are going is to take that sustainability roadmap to cabinet, so that with the time we should have a situation where all the funding is actually generated locally, including private sector, whatever sources that we can get, so that we actually get out of this situation. So that's the process that it has been going on, Honorable Chair and members. And of course, all along we have been drumming the issue that about 80% of the funding has been coming from external, and government has also been increasing every year. Government has been putting 50 billion on top every year, and that's why now at this time the government now has to cover the entire gap which is there. Honorable Chair, on the budget, Chair, the one I talked about, that is what is additional. I have not seen the entire, but because that is the budget for Minister of Health, I have not seen what is there currently. But this is a provision that we actually discussed with the Minister of Finance and then Minister of Health, and that's what they agreed that will be added onto the budget. On the delivery, Chair, I request that I have the head of prevention can give us more information on the issue of delivery of this medication from the medical stores to the respective district centers.
Thank you, BFA. From the center to the districts. And the main system is actually a private system operated by the joint medical stores. They have a large warehouse for storing the HIV commodities, and that space is paid for by PEPFAR, by the US government, and the system for delivering these commodities to health facilities, even that delivery system is paid for by PEPFAR. So initially PEPFAR had stopped this, but as the DFA says, the government of Uganda is preparing to come in and meet that gap, to make sure the delivery. So as he says, ARV shortage is not a problem. It is that chain of supply delivering to the end user, to the health facilities where they are distributed, that has been the challenge, simply because PEPFAR was supporting most of that system, the warehousing and the transportation to the communities.
Your question has been answered, Martin?
Yeah, the question has been answered, but this is where we lose money. Because the deliveries, for instance, that are made in my district, you find that the van comes almost halfway. Now, if you say that AIDS drugs have been left in Kampala because of the transport, and the van that is delivering the medicine in Kamuli has come almost halfway, it's just a matter of coordination of agencies. You know, this issue of duplicating services here is where we are losing a lot of money as government. Because there's no, you can tell me, the vehicle that delivers medicine in Kamuli comes halfway and it leaves medicine in Kampala, which is meant for Kamuli. We lose people die on that assumption that we no longer have medicine. Yet the medicine is in Kampala, and finally it will be billed to destroy it. Billions of money are going to be spent to destroy those drugs.
Okay.
Yeah.
Yeah. Yes.
Thank you, John, which initiated a policy which was traced in the Ministry of Justice of starting to budget for the staff in the respective ministries and agencies, that they should start to budget how to train people how to use condoms. Whether that policy initiated from the commission or they have any clue about it, and whether they have now, it has come to their attention now that the biggest challenge Ugandans are having or are facing in the spread of HIV are the people who don't know how to use condoms. That is one. Two, I want to also know what steps have you taken, since now you have clearly stated that there is a problem in the implementation, about there is some gap in the law. Regarding the other issue of the fund, what steps have you taken ever since you realized that there is a gap? What steps have you taken to ensure that that gap is filled? Thank you.
Okay. Yes. Director.
Thank you, Chair. With your permission on the issue, Chair, that the head of prevention answer that question.
Chair and members, honorable members, you see what the Ministry of Justice is doing is what we call HIV mainstreaming, which is the national policy, which means that every institution, not just the Ministry of Justice, it's not that the Ministry of Justice is a best practice in HIV mainstreaming. Ordinarily, all institutions, or ministries, or departments, or local governments are supposed to be doing mainstreaming, which means the institution is supposed to put in place measures to meet the prevention and care needs of its staff. If I can give you an example, people in the bank, they report in the bank at 6 a.m. and leave at 10 p.m. There is nobody taking care of the prevention needs. Nobody teaching them about condom use. Most of the people in the workforce now were young when we were trained about condom use. And actually our studies show that condom use efficacy has gone solo, because the message is we no longer have that campaign, the resources to run the campaign that taught people on condom use. So they do not just teach condom use, that's just one of the activities. They go a whole spectrum of teaching their staff the positives and negatives on how to live healthy lives free of HIV and its impacts, which is mainstreaming. And they are best practice.
Members, to inform you, when you look at the report of the Dr. General, page 2, what he's talking about is under there, which is called HIV/AIDS mainstreaming, and it's called 0.1 budget allocation for all MDAs, local governments, and ministries. Yes, please conclude.
The issue of what steps we've taken because of this conflict in the law. Chair, as I indicated earlier on, we initiated the sustainability roadmap. And this roadmap is, at the end of it, it's supposed to, we're supposed to have funding which is sufficient for the response. And this money will be coming from government and also from the private, locally generated money. That was what we initiated. Of course, having realized that the trust fund may not work because of the law which is there currently. Chair, that's what I can say.
Okay. Members, before we dive into the matters of the Dr. Generals, how is your relationship with cultural institutions? As we can see, the King of Uganda specifically, Ronald Kabaka Mnadi Mwenda Mtebi. The second is UNAIDS Goodwill Ambassador for ending AIDS in Africa. So how are you conducting your business, or your commission, or your collaboration with other institutions, specifically cultural institutions?
As part of our mandate is to coordinate all the sectors, including religious and cultural institutions in the response. And with regard to the cultural institutions, we have been having very good collaboration. For example, like for the one for Buganda Kingdom, I think for the last how many years, the Kabaka, the birthday run, one of the key items has been on HIV, and that was even this one which happened recently. All the other all the cultural institutions, we have been engaging with them, sensitizing them how there are some cultural practices that promote new infection of HIV. So we have been engaging them to teach sensitize their subjects on some of those cultural institutions. We actually have, currently we have an action plan for the cultural institution that we have actually gone around with the cultural institutions to actually show them the parts that they are supposed to do towards this response. So we have been having very good collaboration, Honorable Chair.
Okay, thank you. There are some members who came before, who came in when they are interacting. Can you introduce
South Nimbara District and a member of this committee?
Okay. When we go to the Auditor General's report, page 1, there is emphasis of matter, which says, without qualifying my opinion.
Thank you, Chair. On this area where the Auditor General has put as emphasis of matter, of about, initially we had planned for 45 million, but what was realized was 700 million. In that, it was really the delay in disposal that was done in the following financial year.
What caused the delay? That's what we need to understand.
The cause of this was because the evaluation is done by Minister of Works. Initially, we had requested Minister of Works to do the evaluation, but then later on, out of the items, because we had planned to purchase other items, other vehicles, but then one vehicle was recalled that we needed, because if we had disposed it off, we were going to have a situation of some of our regions not having vehicles. So it was retained for another 1 year, and that is what caused the delay. The initial evaluation was done, but then later on, one of the vehicles was actually not disposed of.
Members? Yes, Martin?
Thank you, Chair. Retained, and but what we see here, your expected annual is 50 million. So how many vehicles were boarded off? Two, Mr. Chairman, there is a tendency in our agencies. They park these cars for years. At times they ground them intentionally. I have seen incidences where you'll find a vehicle has been parked for over 10 years. But when you ask what happened to that car, they will tell you there was just a simple breakdown on that car. But because one of the staffs had interest in that car, especially the big ones like these ones we have here. I'm not saying you, but the ones behind you are bigger than you. They normally park these cars for more than 10 years. By the time they say it is being boarded off, the car will fetch about 2 million shillings. But when in actual sense the car was parked when it was still good, and it could even fetch more than 50 million. So, I don't know how we shall be able to solve this problem in all the agencies, because it's a common scenario.
Okay.
Chair, can I supplement on that first?
Yes.
By the way, that you have a policy of disposing such assets. If the policy is there, do you tell us it is to place how many years? And why, according to Martin, that you can stay with the vehicle parked somewhere until you see that it is rotten, then you sell it to either yourselves or to your friends. Could you clarify on that policy, please?
Mm-hmm.
We have heard in the introduction. I came in a bit late, but I want to raise a point of procedure, Chair, from the witnesses I see here, Mr. Chairman. Mr. Chairman, this is an accountability committee, and this committee has powers from the Constitution. And Chair, Constitution Article 164 talks about accountability. And Chair, when you read what the Constitution says, specifically one says that the permanent secretary or the accounting officer in charge of a ministry or a department shall be accountable to Parliament, to the funds in the ministry or department. And Chair, from the introduction, which I was watching on Zoom, I don't know that the accounting officer in charge is here.
Yes.
I want your guidance.
If you any guide on that procedure matter, yeah, the accounting officer is here. Mr. Musova, Dr. Nelson Musova. Rotoyera, the Director of Finance and Accounts, to lead the team. So he's here. Dr. Nelson Musova is the one responsible.
Mr. Chairman, this committee has a technical person who is a legal person on the committee. I would need accountability is personal. It's not delegatable. Number two, Mr. Chairman, the Constitution Article 28 talks about fair hearing. If the accounting officer is not had fair here, then our report is likely to be challenged. Then finally, Chair, we shall make recommendations as a committee. And you never know, in one of the queries, we may recommend that the accounting officer should not be reappointed. And we are not dealing with an accounting officer, Mr. Chairman. So, Chair, I wanted the legal person here to guide us whether we can interact with an entity or an agency where the accounting officer is not here and who is the one who is in charge. And finally, Chair, I want to know the person who has been appointed, whether he is the person who spent this money, because we are talking about expenditure. That's why members asking about policies, about the disposal. We are coming to that. Is he the person who spent the money that he can now account for that money? I need your guidance, Mr. Chairman.
Okay. I also inquired and I was.
Thank you, Chair. First and foremost, if the accounting officer delegated, then the principal delegation is as though is himself here. Therefore, whatever the agent does is as good as the principal.
Are you? I can see
Authority.
Yeah, the written authority is here.
It can suffice.
But Chair, for me, accounting officer delegating, but maybe what this committee would want to know from the delegated person, whether he's willing to take whatever comes here as a delegated person. Because sometimes this committee leads somewhere. If we find something and then we hand over him to the police, whether he's okay with something like that in case it arises.
Bakabulindi,
As the practice, he has accepted to carry the Rubengo. Our simple solution is takes an oath that whatever happens, he will be responsible.
that's it. Yes, Nangoli, what is?
We debate on national issues. You are citing the law, you are citing the constitution. But from the very beginning, during the preamble, you're ready to ask a letter. It is a committee that the accounting officer wrote to you, indicating clearly that he is unaware, but he has assigned one called Mr. Quinto to take lead among others. So I don't see the reason as to why we are saying that no, now that he's here, he should take oath in order to stand the liability in case of anything.
Okay.
I know, of course, the issue of oath takes precedence, but not all the time we should put people on oath.
Thank you for the supplement. Let's continue with the matter.
Just a small one. You know, I have been on Kosase with the Honorable Nangoli since I joined. I've had 2 incidents in this Kosase where the accounting officer delegates, and then when the results come back, he says, the power that I gave to the person I delegated wasn't reaching that level, and therefore I am not responsible for what he responded. In Angola, you remember those 2 incidents in 2 agencies. So for me, I was bringing it basing on that background.
So now, let me guide on these members. So, the sublimation you have made now, that is responsible. Yes.
And oath is not a punishment. Honorable Nangoli. 2, I'm saving him. When he was being delegated, he was delegated based on questions from the Auditor General. But this committee has a habit of going even deeper to ask certain questions. Now, should such a question arise and the principal person was not aware, is the person delegated responsible or not? Simple and clear. Unless we agree that if we raise the question outside what is here, then it's not responsible. I want to safeguard him.
Okay. Yes, let me hear from.
I want to agree with our technical person on delegation. But Chair, I still want to insist on that Article 164. I now go to B, because I read A. I now go to B, and the B says that any person holding a political or public office who directs or account in who directs or concur in the use of public fund contrary to the existing instructions shall be accountable for any loss arising from that use and shall be required to make good loss even if he or she has ceased to hold the office. Chair, when you look at these statements are personal. So the legal person, as the Honorable Bakabindo was saying, we are not going to look at only the Auditor General's report. We shall go beyond the Auditor General's report because it is within our mandate and start asking questions about the entity. So if you think, Chair, that delegation is sufficient, and the person who has been delegated is able to take on the mantle, then you should take a note and take on the mantle for whatever questions you want to ask on the agency. And
Chair, whereas I've listened keenly, I've listened to the seniors and I should take back to our rules of procedure. They don't allow us to legislate in under anticipation. What is happening now is that the members are anticipating what may not be. We are anticipating. Can we go to reality and listen to? Members are anticipating, which is not. Our rules do not allow that.
So members, whenever you see to give us sufficient information, whether we are not conversant or maybe is lying or is not adequate, that's where the issue of gone oath, that's where it can come in. Let me hear from our technical personnel, the legal counsel.
That the accounting officer, it could be any person who made the loss. That's when Article 164.2 comes into play, that person makes sure the accounting officer was involved in any loss which was made. That's when you call him for a hearing on that loss, not on the general queries. On that particular.
So members, I think you have been guided very well on that. Let's proceed. So you are raising your matters under collection of non-tax levy. So can we continue, members? If you are done with that, so let me call.
Thank you, Chair, Honorable Chair and members. The questions that the members raised was, one was the kilometers, 100,000, then that vehicle, it would be due now for disposal. Chair, those were the... When the age of the vehicle is 5 years, the kilometers, 100,000 kilometers, then that vehicle would be due for disposal.
Okay, so...
Sold them.
Yes.
They were 5 years.
They were more than 5 years.
More than 5 years.
Yeah.
And they fetched how much?
Chair, maybe I can read. The first vehicle, which was UAN 466N, which was valued by the Minister of Works, was valued at 18 million. And the highest bidder was 18.5 million. Then we had another vehicle, which was a Ford Ranger, which number UAR544Y, which was valued at 16 million. And the highest bidder was 16.4 million. And then the last one was a Isuzu D-Max pickup, was valued at 13 million, and the highest bidder was at 13.3 million. So those are the three vehicles which were sold.
Okay, Doctor, sorry, Mr. Quinto, in your financial statements, can you go to note 28
Chair,
and explain to us what happened to that vehicle? Page 31. Are you there?
Yes, I'm on 31.
Yes, note 28.
Yes.
What happened to that vehicle?
Chair, this was not a vehicle. This was a liability on maintenance. This is a garage bill. It was a garage bill, it's not for purchase of vehicle. This is part of the liability. One of the garages that had provided service closed down when there was a bill which was supposed to be paid. So that's why even up to now it is still in the books.
So then action taken. What's the action taken on that? Is it going to be recurring every financial year because it has been occur in every financial for almost, I think, it's 5.
Chair, we normally write to the accountant general to allow us to write off. And last time we did with some of them, but this is one of those which is due really for write off, to be written off.
You wrote?
After writing, no. We have not written. We have not written to the accountant general.
You said you wrote to that?
We wrote for there were other cases. After the audit was done, some of the suppliers who were there, they were actually nowhere to be seen, even whatever. And some of these, by the way, this one we inherited. This is not a
from who?
From AIDS control program. This is very old bill. 208 actually.
Excuse me, Chair.
Okay, yes.
I want to clarity on that, Mr. Kuito. You are saying it arose out of that garage closing. The garage closed when it was demanding money.
Maybe I can clarify, Chair.
Yes.
We had inherited this bill by the AIDS control program, and then we've been having it on our accounts. Then the Auditor General, the Accountant General, did, because it is part of the domestic arrears.
Yes.
So when the audit was done, each of these suppliers were requested to provide evidence that they had provided the services. So those ones who provided were cleared.
Okay.
Some of them who did not provide, those are the ones which are written off. This one particularly, by the time when the audit was done, it was clear that this was outstanding. So when we wrote to them that we wanted the account number to pay, we found that it had already closed, but the owner had already opened another garage. So there was complication. We couldn't pay the person when the company who supplied by that time was not there. So that's what happened. So this bill of 2.5 million is related to that.
Okay. Kasola, you have an addition to that? Okay. Let's go to 1.2.
Chair.
Yes, Chiwanka.
Yes. The mandated 100 kilometers, 100,000 kilometers, or the 5 years limit to be on the road. How long did it take you to dispose it of?
Chair, some of these vehicles, maybe I can start. One of them was 2010. It took Chair, maybe I can add that if the vehicle is still running and they had already actually reached that limit for disposal.
But you have not answered what I asked.
Mr. Chair.
Yes.
No,
I
Chair,
think we
you
have
have not answered
backup
what I
links.
asked.
You see, Chair, Uganda, most agencies have got policies, and that's why it is. We are not blaming you. I ask, do you have a policy? You can buy a vehicle in 2019 when the vehicle was manufactured in 2008. What is your policy say? As from the date when you bought it, as from the date of manufacturing, and how long are you supposed to use it? I think it was a very simple question. I know with finance constraint, you may stress and say we have no other new ones, let us use it. But you first tell us, do you have the policy? And what does this say?
In addition to that,
Yes, Martin.
you know, government.
Which government are you talking about?
Mr. Chairman, I'm driving a car of 208. 208. Mileage 150. It's parked here. Then look at it.
150,000?
150,000 kilometers. You sit in it, you'll feel a brand new car.
This is to you.
Now,
To you.
That is according to
you sit in it, you'll feel a brand new car. Mr. Chairman, when I hear that, 5 years we dispose it of a car that bought 300, 250 million, the value is 18 million. I see this as a joke in government. It's a joke. It's a complete joke. Because mine that I bought.
Procedure. Thank
Who is
you.
saying procedure now?
Thank you, Mr. Chairman. Chairman, all those entities that belong to government get their budgets from Parliament. And if Parliament approves money to buy vehicles in a period of 5 years, it is not the problem of the entity that has requested for the money. Is it therefore procedure for the member who gives those entities money to buy vehicles in 5 years to put to task the entity to explain that? Is he proceeding well?
I think the honorable member is supposed to recommend what should be done. Honorable Martin, you need to recommend what should be done as members of parliament, specifically on that matter.
Information I want to give. Let me give this information.
Take the information.
Take my information that the government came out with a policy, well studied. You cannot compare your vehicle to kilometers, but it goes to show it is driven here and there. We all came from government.
What are you talking about?
That once it reaches that mileage,
Order, Mr. Chairman.
and the
Order.
5 years,
Order.
it has to be disposed of.
Order, Mr. Chairman.
Been given the information. Please
Mr. Chairman, I want to thank my colleague for giving information, but that's where the problem is, because the justification I was giving, the car, you cannot compare, because I am talking about 150 kilometers. So this is about mathematics. If you didn't listen to me, just understand it. Because I'm talking about a car that has been driven for 150 kilometers, but is still on the road and comfortable. And you're talking is a brand new car that was brought in. And you say these are comparing.
Which chair? What is the point of order?
Mr. Chairman.
No, Chair, let's make
Mr. Chairman, as I conclude over this matter.
Please conclude, Martin.
You from
You don't have enough time.
Policies are made by this parliament, and they are not cast in law, Mr. Chairman. Where we say problem,
That's it. That's what I guided him at the point of the procedure matter. Yes, Mr. Quinto.
The manufacturing could have happened a year earlier, but still it is considered as the date of manufacture.
Okay.
The date of purchase, rather, when we buy it, most of them were new.
Okay.
But Chair, you know, you are talking to members of parliament, you guys. What do you mean when I say manufacturing? Even if I go to the body now I buy that one of 2010, it's new. You just make one statement. We consider manufacturing date. And
Yeah, that is right. It is manufacturing date.
Okay. Thank you. Honorable members, before we go to 1.2 failure, let me have a comment from Mr. Quinto. And that is the last page of the Auditor General's report, section 4, donor funded projects audited. The Commission is implementing the Uganda Country Coordinating Mechanism, CCM, the project funded by the Global Fund. The project was audited by my office during the year under review, and a separate report was issued. But my auditor has informed me that the report is not yet out. I want to get information from you. How much money is involved in this global fund for this project, and what are the implementations? What are the activities as of now which have been done? Specifically, let us know what's the exact amount of figure.
Chair, maybe I could a country coordinating mechanism for the global fund.
The
CCM. We house them. We house them. What they do is the global fund is in partnership with the government of Uganda for the provision of the fund which is used for the HIV response. So the government of Uganda provides counterpart funding. Global Fund also provides their counterpart funding to run this CCM. The work of CCM is actually to provide oversight.
Yes.
The work of CCM is to provide oversight over the money which is given by Global Fund to the government of Uganda. And this comes through, when the money comes, part of it goes to the Ministry of Health, part of it goes to TASO, because it includes even the other sectors. So the Global Fund work is to, the CCM work is to provide oversight. They have a board that provides oversight over this to make sure, like the Minister of Finance, which is the main recipient for the government, they do provide reports on how much money they have used, how they have used it on a regular basis. So that is actually what the Global Fund they do. They also write the grant. Like currently we are about to go into that writing of the grant. The last grant that was written, Global Fund provided $500 million for 3 years, which is for HIV, for malaria, and then for TB. So those are the 3 diseases that they've been supporting.
Andy?
The funding is still there. Of course, this one is going up to 2026, the current one. Yes, going up next year. And then another proposal will be written to the Global Fund for additional money for another 3 years.
Commission, what is your responsibility in this project?
Chair, our responsibility is...
because when I can see, that is almost 2.2 trillion, isn't it?
Yes.
You look at this, the funds in Uganda shillings, almost 2 trillion.
Yes, that's the money that goes to the to the Ministry of Finance, to the government consolidated fund, and then to the TASO. So, Chair, as you are asking, what role do we play? When the government of Uganda is remitting money to the CCM, it is through subventions. So we are the ones responsible for that money. When it comes, we pass it on to the global ministry for the CCM, and we are responsible. We have the responsibility for accountability of that money. That's why even you see there, the accounting officer is the one who has signed for it to make sure that that money has been used for that purpose.
Honorable members, do you have any question on that matter? If you don't, we proceed. Okay. We go to 1.2, failure to enforce the 0.1% budget allocation for HIV or AIDS mainstreaming. Then Roman numeral 1, failure to implement HIV and AIDS mainstreaming requirements. Yes, Mr. Quinto, can you respond to that? You failed.
Thank you, Chair. For this, Chair, you're aware, and members, that Uganda's Commission's work is to coordinate the HIV and AIDS response in the country. And one of the areas that came about, because this is a multi-sectoral response, every department, every sector is supposed to play a part. So when Uganda's Commission, together with Minister of Finance, came with a provision that every entity that is funded by government should provide 0.1% of their budget towards the HIV response. That's when this one came into place, and we went around. We actually sensitized all the government ministries to do that, and we always monitor how this money is being budgeted. So when the Auditor General was auditing, of course, realized that there are some districts that had not made provision for this, and that's what has been reported. And every time when the Secretary to Treasury is sending out the budget call paper, one of the items is that the accounting officers should provide 0.1%. So this we are following them up with the Ministry of Local Government, because most of these are the accounting officers at the local government who did not provide this money. But as we talk now, we have gone ahead to work with the Ministry of Finance. There's a code which has been created, which is already there, and we are going ahead even to have another provision in the PBS, the one they use, the software they use for planning, so that we monitor how they're using that money. So our work is really to monitor where there are gaps, we follow them up. And Chair, that's what happened this week.
Yes, Honorable Baka.
Chair, I want to commend the good work being done by Uganda AIDS Commission, and I think you are very much aware of the objective why it was established. I don't want to blame you, but if you look at the guidelines for the multi-sector HIV/AIDS mainstreaming, they are very clear. Fantastic. But if you look as AIDS Commission, what steps are you taking to see that you fulfill the main objectives why it was established?
And on top of that, when you look at the Auditor General, none or inadequate funding of HIV and AIDS intervention suffocates the attainment of the set target of ending AIDS as a public health problem by 2030. As shown, as has been indicated, and out of 116 local governments, only 60 managed to develop their strategic plan. So you see, if Bakabulin said that we are below standard, I think I can agree with him. Yes?
The whole world is aware about the Trump measures to curtail aid outside US, and one of the major funders to Global Fund basket is US. We have heard from you that stating that in 2026 you hope to renew an application to seek for more funds to the tune of around 500 million US dollars from Global Fund. What if that application is rejected? What is the next plan? What alternative plan do you have to fill that gap to ensure that we curtail the spread of HIV/AIDS by 2030?
Honorable Chiwanuka, are you on the issue of failure to enforce 0.1, or you are brought in another matter? Please try to be following. So you have to follow the report so that we can move systematically.
Because when he mentioned about it, Honorable Chair, it has come to my attention because he said it. And I said, now, if he's planning to make an application afresh in 2026, is it a campaigning tool or really he means what he's saying? So I need an answer.
Honorable Mpindi.
Chair, I personally wanted to ask that. Someone asked it before I came. It is a good question for Ugandans, since we are having Uganda AIDS Commission. What mechanism are we going to use to see that even when the cuts are going all over, we remain in existence as Uganda AIDS Commission? I think it is a good question if they have the answer.
Honorable Mpi, let me guide you. That question was brought before, maybe because you came late, but that question was answered thoroughly. Honorable Okupa.
Thank you, Chair. Chair, I think Chair, be of help. The MDA responsible for looking for resources for the country is the Ministry of Finance and Health for these purposes.
So I think it should be the people who should ask this question. That now that the American government is turning down on this, what is Minister of Finance, which areas are they looking at? They're looking for money to address these gaps which have been created by the new policies in the US. Because Uganda H Commission are just users, I don't think they are resource mobilizers for this type of things here. They're just technical people who implement these policies, but the resources, is mainly the main person who looks for the money is the Minister of Foreign Affairs. Minister of Finance. Thank you, Chair.
Okay, thank you. When you look at page 3 of the Auditor General's report,